Cardiovascular disease is the leading killer in America for both women and men. The same is true in the Tennessee Valley.
Every day, a team of hundreds of doctors, nurses, and support staff provide world-class cardiovascular care at Huntsville Hospital.
We're experienced and highly skilled in the treatment of cardiovascular emergencies, and our focus on prevention and wellness keeps our patients' heart healthy.
Huntsville Hospital is home to the busiest cardiac cath lab in the state of Alabama, and our cardiovascular surgery program is not only ranked #1 in the state, but also in the top 10% nationally.
Thanks to our partnership of hospital leadership, medical staff, and generous donors, we're equipped with the latest technology and procedures to treat even the most complicated cases right here in North Alabama.
Our cardiologists treat patients in hospitals all across the region, including Sheffield, Decatur, Boaz, Madison, and Fayetteville.
Most people coming to the Heart Center experience chest pain, shortness of breath, and feel tired.
Well, I was pretty stressed out when I walked in that morning. You're thinking about things you'd never thought about in your life. You're thinking about, tomorrow, am I going to see my family? Young lady, I think her name was Laura Beth, a nurse. She was probably 25, 26 years old, meets me there at the door. She's smiling, she's relaxed, never had a chance to stop and think, woe is me, or oh my God, what's happening? She just kept that in an upbeat manner of, we're going to do everything we can and you're going to do fine. We're doing, you've got a good team here.
They come in a lot of times to the hospital unexpectedly and very scared about their condition. And when they have a nurse at the bedside and staff that's caring for them and knowledgeable, they're so appreciative. And we hear those stories, and it really makes you realize what you've gone into healthcare for.
When a patient suffers a heart attack, the American College of Cardiology recommends performing angioplasty within 90 minutes of arriving at the hospital. It's called door-to-balloon time. The Huntsville Hospital team works fast.
Well, it's important because the longer someone has a blocked artery, the longer the duration of the heart attack, the more heart damage there is. If you can open it up before 60 minutes, they may have minimal amount of heart damage. There are very few places that do as many heart attack cases as we do. We did over 500 last year and over 400 the previous 2 years. We're at 54 minutes the past couple years. And so we have a highly refined and very simple but effective system.
Dr. Alex Vasquez and Dr. Ben Washburn lead a team of cardiologists and CV surgeons. They plan the best treatment for heart center patients with complex heart valve disorders.
Cardiologists are specializing a lot more. If you look at the whole cardiovascular disease spectrum, it is going to change to involve a cardiovascular team approach. It will not be one person taking care of everything. It will have to be a matter of unifying everybody's skills into a single location. And that single location is what we consider the hybrid lab. And the foundation has been key in trying to assist us in making this a reality.
So when patients come to see me, it's because their heart has gone in or out of rhythm multiple times, typically. And that's where their heart beats or palpates fast. They feel symptoms like short of breath or feel fatigued. We work to try to extinguish those signals that are firing inside the heart that are abnormal so that our normal heart rhythm can continue. Convergence is a new technology or new technique where we attempt to ablate or cauterize inside the heart both from the outside of the heart, and that's done by a cardiac surgeon, and from the inside of the heart, and that's done by someone like myself who's a cardiac electrophysiologist. One of the things that we need in order to do this type of procedures in the electrophysiology lab is we now use an ultrasound machine that can move up through the vessels and rest inside the heart. It actually shows us a real-time picture of where we are as we're doing the procedure. And it allows us to really visualize or see what we're doing inside the heart.
When I'm talking hypothermia here, I'm talking about neurologic recovery in someone who, for whatever reason, died out in the field. Right now, the recovery on that is just zero, brain recovery. The quickest, most effective hypothermia system so far is the one we use as Life Systems. We put them in this ice. We try to keep them cool for 24 hours and try to do it quickly, because the earlier you do it, the more brain you can potentially save.
The newer operation that I've started doing since I've come here is called minimally invasive aortic valve replacement, and it involves an upper sternal splitting procedure where we make a smaller incision, just the upper part of the chest. All the patients have been very satisfied with the procedure. They are having less pain. They are much more pleased with the scar, the residual scar, and their strength tends to come back a lot quicker. They're recovering faster than we've seen in the past.
George Jones didn't feel any of the classic symptoms, but because of heart disease in his family history, his doctor scheduled a test checking the blood flow around his heart.
I was shocked to learn that I had 2 blockages in the major artery of my heart. Procedures at the Heart Center took care of that, but I realized I needed to make some life changes. I diet, I exercise 4 days a week, and I get regular checkups at the Heart Center. I feel great.
As chairman of the 25th Annual Huntsville Classic, Charlie and I are glad to have the opportunity to serve our community and Huntsville Hospital.
On Saturday, we will see many of you at Hampton Cove for the Classic Golf Tournament. David will showcase his tour quality approach shots.
And I guarantee that at least half of Charlie's penalty drops will show on his scorecard, with minimal drama along the fairway. Our families, friends, and co-workers have all utilized Huntsville Hospital's services. There's no need to go anywhere else for our medical care. We have world-class physicians, facilities, and technology right here in Huntsville.
By joining us here tonight, you're helping raise the standard of care provided by Huntsville Hospital's cardiologists, cardiovascular surgeons, and their staff. Together, we're providing cutting-edge technology benefiting countless heart patients.
Your generous donations provide the latest equipment that a talented team uses every day to save lives.